I'm sleepwalking. I'm sleepwalking, so help me. I can't stop, I can't go. Like I'm out of water, so I beat the
MTM pharmacist. What? Hello?
Hello, my name is Angela, and I'm a pharmacy coordinator calling on behalf of Your Awesome Health Plan on a recorded line. Is this Carl Michael Reeves?
Yep, yes it is.
Hi, Carl. How are you doing today?
Uh, I'm I'm fine, thanks for asking.
Great. I'm glad to hear that. I was calling because it is time for your annual medication review. Your Awesome Health Plan would like you to discuss your medication with a pharmacist. I have a pharmacist available now, or I could schedule that for you. Which would you
Well,
prefer?
I'm not really sure I need to discuss my medications with a pharmacist. Why would my health plan want me to do that?
Great question. Your Awesome Health Plan provides this review as part of their medication therapy management program. They provide this review because they understand the importance of a pharmacy reviewing your medications.
Isn't that what my doctor does with me, though?
Absolutely. The pharmacist is looking at it from a different perspective to see if they can optimize your medication to be more effective in helping your physicians achieve their treatment goals.
Uh, yeah, okay, I guess that sounds fine.
Great. Now to get you scheduled here, can I have you verify with me your date of birth and zip code?
I'm a little leery of giving out that information over the phone. I don't mean to be difficult, just, with everything going on out there. I'll tell you what, how about you tell me what you have and I will tell you if that's correct?
I completely understand your concern with sharing your personal information. However, for privacy and security purposes, I am required to confirm that I am speaking with the correct member. I can tell you that I see that you are currently 70 years young.
Yeah, that's me, Mr. Spring Chicken over here.
Great. Would you mind verifying with me the month and date of your date of birth?
Sure, 1219.
Thank you, Mr. Reeves. I really do appreciate it. And then your zip code?
54487.
Thank you so much. Now, Mr. Reeves, are you the one that handles your medication, or do you have someone that assists you with that?
No, I take care of my own medication. I may be no spring chicken, but I'm not no complete gray goose over here either.
Of course not. It looks like I could have someone from the pharmacy give you a call back this afternoon between 1:30 and 2:30. Would that work for
Uh,
you today?
better not today. I'm actually just heading out to run some errands and then got my stand-in nap appointment, and then after that I'm pretty much useless for the rest of the day. Better aim for sometime tomorrow.
Sure, that's no problem at all. How does tomorrow morning between 9 and 10 o'clock sound?
Sounds happier than a claim in high water.
Great. Now, is this the best number to reach you on tomorrow?
Yeah, yes, ma'am.
And is there a backup number we can put down just in case?
No, no, I just have this cell phone here. We got rid of our landline. Too many crane calls anymore. And I don't even really know how to use the darn thing.
Oh, well, that's no problem at all. Now, for the review tomorrow, you'll want to have your prescription bottles or an up to date medication
Okay.
list. Additionally, you'll want to have a list of any drug allergies, any over the counter items that you use, and don't forget to include the non oral items such as eye drops, inhalers, or nasal
Yep.
sprays.
Okie dokie. Not a problem.
Fantastic. In summary, I have you scheduled for your medication review tomorrow morning. Our pharmacy team will give you a call within that 9 to 10 o'clock time window, and we'll be calling you from a 515 area code number.
I'll keep an eye out for it.
Mr. Reeves, I do thank you so much for your time today, and we'll look forward to speaking with you tomorrow between 9 and 10 o'clock. I hope you have yourself a great rest of your day.
We'll talk to you then.
Take care now.
Hello?
Hi, my name is Christy Joe. I'm a pharmacy coordinator calling on behalf of your awesome health plan on a recorded line. Is this Carl Michael Reeves?
Yes, this is he. Yes, ma'am.
Hi, Carl. I'm calling for your scheduled medication review. Is this still a good time?
Yeah, I believe so. Let's give it a shot.
Great. Well, before I get you connected with the pharmacist, I just need to ask you a few questions. First, if I could have your date of birth, please.
Yes, 12/19/52.
Thank you. And if I could have your zip code, please.
54487.
Thanks. All right. Now, the pharmacist will be discussing your prescriptions and over-the-counter medications, as well as your allergy information. So for the medications, they'll go over the names, strengths, directions, and what you use them for. So it's best if you either have the bottles or the medication list available. Do you have either one of those?
Yes, I have my medication list.
And will you be able to tell the pharmacist any medications you're allergic to?
Yes, absolutely.
Now, after the call, we will send you an updated list and a summary from the discussion. So for your mailing address here, I have 1004 East Prescription Road in Farmville, Iowa. Is that correct?
Yes, ma'am.
All right. So I'm going to go ahead and get you to the pharmacist. As they're going through those medications, you can always stop them and ask questions if you have them.
Actually, I'm sorry, but now's actually not really a good time to do this. You see, my cat, Miss Fluffykins, is getting married today, and she's having a little trouble fitting into her wedding gown. Just one too many greenies, I suppose. Would it be possible for you to give me a call back around this time tomorrow?
Absolutely. We will talk to you then and give my best wishes to the happy couple.
Yes, ma'am, absolutely. Thank you so much.
Thank you.
I'm coming, Mrs. Fluffykins!
Okay, who is my next patient? Carl Michael Reeves. I remember this patient. So Christy Joe rescheduled him with me since he couldn't complete his review yesterday. All right, let's see if he's ready today.
Hello?
Hi, my name is Shawnee. I'm a pharmacy technician calling on behalf of your awesome health plan on a recorded line. Is this Carl Michael Reeves?
Yes, this is he. Thank you so much for calling back today. Miss Fluffykins' wedding was beautiful.
So glad to hear that. So is now a good time for your medication review?
Yes, now's a great time.
Great. So first I'll update your medication list, then I'll get you connected to the pharmacist so you can have a discussion about your medications. First, let me make sure I've got the right profile pulled up for you. Could I have your date of birth, please?
Yes, 12/19/52.
Thank you. Could I have your zip code, please?
54487.
Now, after the review, we'll send you the updated medication list and a summary from the discussion. I have your mailing address as 1004 East Prescription Road in Farmville, Iowa. Is that correct?
Yes, that's correct.
Okay, now before we update your list, I want to make sure I've got your allergy information documented. Are you allergic to any medication?
Yes, just allergic to penicillin.
Okay, and what kind of reaction do you have with penicillin?
Just kind of hives and really red all over.
Okay, hives and redness, got it. Anything else you're allergic to?
No, that's it.
Okay, so I'm going to update your medication list now. It's best if you have your medication bottles available. Do you have those, or do you need a moment to go grab them?
No, Angela, the one who set this all up with me, she told me have them ready, so I got them all out and ready for you.
Would you like to start reading from your bottles?
Sure, yeah. The first one I have here is the atorvastatin. I don't think I'm saying that right. Atorvastatin, 20 milligrams.
the atorvastatin, 20 milligrams. I do have that here. How many tablets do you take?
Oh, just one in the morning.
Okay, so 1 tablet daily in the morning. Got it. Now, what do you take this medication for?
I think that one might be for my heart. I'm not really sure.
Okay, no problem. We can double check with the pharmacist and ask her what that one can be used for. What's the next medication you've got there?
The next one is my metamorphin, 500 milligrams. Man, these names are tough to say.
Oh, you're doing great. Okay, metformin 500 milligram tablets. And how many tablets do you take?
I take 2 a day.
Okay. Do you take them both at the same time or do you split them up?
Oh, sorry. I'm supposed to take 1 in the morning and 1 in the evening with breakfast and dinner.
Okay, so the bottle says take 1 tablet twice daily with meals.
Yes, yeah, that's right.
And do you always take it that way, Carl?
No. Sometimes I forget to take it in the morning. If I have to get up early, I'm not really a morning person. And sometimes I'm just really tired when I have to get up early, so I just eat my breakfast and then I go relax, and then I usually end up falling asleep on the sofa and forget.
I could understand that. I'm definitely not a morning person either. I'll just make a note in here that your instructions are to take it twice a day, but sometimes the morning dose is hard to remember. When we get the pharmacist on the line, she can discuss some ideas for remembering that second dose.
That would be super helpful. Thank you.
No problem at all. Now, what do you take the metformin for?
Yes, this one I know. I take for my
Okay,
diabetes.
for diabetes. Okay, that looks like all the medications I have here on my list. What other medications are you taking that we haven't discussed?
Well, we didn't talk about my shot that I give myself.
Okay, what is the name of that medication?
It's called Victoza. I use it every day.
Okay, Victoza, I'm adding it to the list now. How much of this medication do you give yourself?
Well, I turn the dial up to the 1.2 setting, and then I give myself a shot of this one every evening since I clearly have trouble remembering meds in the morning.
Okay, so Victoza, you inject 1.2 milligrams under the skin once daily in the evening. And are you using this for your diabetes as well, or for something else?
No, that's also for my diabetes.
Okay. Which doctor orders this medication for you?
Well, that comes from my diabetes doctor. Dr. Some Kind of Wonderful.
Great, I've got that added. Are you taking anything else? Maybe anything over the counter, aspirin, vitamins?
No, I don't take anything over the counter. That's all my medications.
Okay, great. So I've got your list up to date now, and I'm going to get you connected with the pharmacist. She'll go over your medications with you, and you can ask her any questions that you might have.
Sounds great.
I'm going to put you on a brief hold, and I'll be right back.
All right, sounds good.
Hi, Carl. Are you still there?
Yes, I'm here.
So much for holding. I've got Kelly on the line. She's the pharmacist that will assist you from here.
Thank you, Shani. Hi, Kelly.
Hi. Hi, Carl. My name is Kelly. I'm the pharmacist. Thank you for taking your time to speak with me today. I'm glad we get a chance to talk through your medicines today. Please let me know if you have any medicine questions as we finish reviewing your list. When we are done, I will mail you this typed up medication list along with a summary of any helpful information that we discuss.
Okay, that sounds great. Thank you.
You're very welcome. Carl, the first thing I wanted to discuss is your diabetes medicines. Are you having any concerns with how your blood sugar is controlled?
Well, my doctor does say it has been better. So I think it's not quite where it's supposed to be yet. I really have to be working hard to not drink soda and eat more vegetables. Well, I'm working hard to eat more vegetables, not eat more, but you get it. Anyway, I have started taking walks with my cat each day as well.
Sounds like you're making some very positive changes. I think that's great,
Yeah.
Carl. Yeah. Eating well and being active are such important things to help your blood sugar. How do you feel like your medications are working?
Yeah, I think they're doing pretty well. I take my metformin with food. The doctor said I might have a little diarrhea with the metformin, but I have kind of gotten I'm used to having it, I guess. It's just hard to remember the morning dose sometimes.
I understand that, Carl. Thank you for telling me that. Do you feel like there is anything in particular about the morning dose that makes it more difficult?
Well, there are several days a week I have to get up early, and I tend to just fall back asleep for a nap on the couch. I don't really like getting up early, so.
I certainly understand that, Carl. I admit I do not like to get up early either. Do you feel like it might be helpful if you could take both metformin tablets in the evening?
Wow, is that possible? Because that would be so much better.
It is. There is a different type of metformin that releases slower into your body, so it can be taken in one daily dose with your evening meal. Also, this type of metformin that they call extended release can even be less likely to cause nausea or diarrhea.
How can I get the other metformin?
Carl, if it would be beneficial for you, I would like to send a note to your doctor and ask if they would switch your prescription to this extended release metformin. It should then be taken with your evening meal each day.
Please, that would be really helpful.
Absolutely. It is my pleasure. Is this Dr. Some Kind of Wonderful that prescribes your metformin?
Yes, that is correct.
I see that the phone number for her is 123-456-7890. Is that still the best number I can reach your doctor at? It looks like the number is for the office on 123 Grand Funk Road.
Yes, that is correct. That is where I see her.
Perfect. Carl, if she does call in a new prescription for you, what pharmacy would you like her to send the prescription to?
Rock and Roll Pharmacy on Rock Road is where I get prescriptions filled.
One other thing I did want to discuss was your atorvastatin medicine. Shawnee had mentioned the doctor talked about this medicine being helpful for your heart.
Yes, she did. I don't remember the specifics, but my friend takes it for high cholesterol, but my cholesterol's always been fine.
Thank you for sharing that, Carl. It is true that one purpose for this medicine is to help lower cholesterol. Now, since your cholesterol has been good, it may be that your doctor is giving you this medicine for heart protection.
Yes, that sounds like what she mentioned.
I think it's a very good choice of medicine. This type of medicine has strong evidence that it can actually lower your heart attack or stroke risk when you have diabetes. It can be an important part of your heart health when you are diabetic.
Oh golly, that does sound important. No one told me how important it was before.
I'm so glad that we got to talk through your medicine today. And I will send that note about metformin over to Dr. Wonderful. If you do not hear from her in a few weeks that she okayed that change, please do reach out to her to ask. I have placed a reminder with that information in the paperwork I am mailing to you. What other medicine questions are you having today that I could help with?
I don't think I have any other questions today, but gosh, this has been really helpful. More than I expected. So thank you for caring about my health and talking it through with me.
You are most welcome, Carl. Thank you for taking your time to talk with me today. You will receive this medication list with my notes in 1 to 2 weeks in the mail, and I am including our phone number in there. Thank you for taking your time for us. We wish you a wonderful rest of your day.
Yeah, thank you. You as well.
Goodbye.
All right, bye.
Carl Michael Reeves spoke with Kelly, forgets to take his metformin morning dose, recommending metformin, ER in the evening. So, all right, let's call Dr. Some Kind of Wonderful.
Hi, thanks for calling Dr. Wonderful's office. This is Nurse Betty speaking. How can I help you today?
Hi, my name is Maria. I'm a pharmacy coordinator calling on a recorded line about a medical concern. I was hoping to speak to a nurse who can help me with that.
Sure thing. I think I can help you. What's going on?
I'm calling about the patient, Carl Michael Reeves. Date of birth is 12/19/1952. Just let me know once you've got him pulled up.
Okay, 1 second here. Okay, I've got Mr. Reeves pulled up here. What can I help you with?
One of our pharmacists recently reviewed Mr. Reeves' medications. During that appointment, Mr. Reeves stated that he has trouble remembering to take his metformin 500 milligrams in the morning and that he's having some diarrhea with the metformin.
Oh no. Yeah, we definitely don't want that.
The pharmacist wanted to recommend, if the doctor is agreeable, to change the metformin 500 milligrams twice daily to metformin 500 ER to 2 tablets once daily with the evening meal, since Mr. Reeves stated that he can remember evenly dose more easily.
Okay. That extended release version should help with that diarrhea too.
Exactly. Do you think we could make the change for Mr. Reeves? Or should I fax over a copy of the recommendation for you to review?
I think this change sounds like a great option for the patient, so let's do it.
Great. Would you mind calling the prescription into his preferred pharmacy? It looks like that is Rock and Roll Pharmacy on Rock Road.
Yes, that's what I have in his file, and that's no problem at all. I can get that called in today. Thank you for reaching out to make this recommendation.
You're welcome, and it's no problem at all. I appreciate your time and have a wonderful day.
You too. Bye.
Goodbye.
All right, let's see who we're following up with today. Carl Michael Reeves. He's experiencing diarrhea with metformin and forgetting his morning dose. Okay. It looks like the doctor changed that to metformin extended release. Let's see how that's going for Mr. Reeves today.
Hello.
Hello, my name is Kevin. I'm a pharmacy intern calling on behalf of Your Awesome Health Plan. Our pharmacist spoke with you previously about your medications, and I was calling to follow up with you about some of the recommendations that were made.
Okay, great.
Fantastic. Before we do talk about any of your personal health information, do you mind verifying your date of birth and your zip code, please?
Sure. 12/19/52 and 54487.
All right. Thank you so much, Mr. Reeves. All right. Now, I see that you had mentioned that you were experiencing some diarrhea with your metformin and forgetting to take that morning dose. Is that right?
Yeah, that's right. Kelly actually got my doctor to change the medication for me because of that.
Yes. I see here that she recommended switching to the metformin 500 milligrams extended release so that you could take 2 tablets at the same time. So you're taking it once daily with your evening meal. Were you able to pick that up from the pharmacy yet?
Yes. I've been taking it for about a week now. It's been working great.
I'm so glad to hear that. Do you feel comfortable, like it's controlling your blood sugar without causing that side effect of diarrhea?
Yes, definitely.
Okay, great. And how about taking both of those tablets with your evening meal? Are you able to remember that a little easier now?
Yes, I am able to remember to take it with my dinner. It's so much better than trying to take it 2 times a day. So I really appreciate it with all the help with that.
Absolutely. It's our pleasure. Now, I just wanted to mention that it is important to make sure you stay on top of taking that medication because it helps you control your diabetes, which will reduce your chances of having a heart attack or stroke in the future and reduce the chance for any hospitalizations as well.
Oh, yes. I remember Kelly mentioning that. Thanks for reminding me. I'm definitely trying to stay on top of taking all my medications.
Okay, of course. I'm glad to hear that. Since your medication review with Kelly, have you had any other issues you'd like me to mention to her?
No, thank you, though. I really do appreciate you giving me a call and checking on me.
Oh, of course. It was my pleasure. Thank you for your time today, Mr. Reeves, and I hope you have a wonderful rest of your day.
Thank you. You as well.
Thank you. Bye.
Bye.
You can count on me like 1, 2, 3, I'll be there. And I know when I need it, I can count on you like 4, 3, 2, and you'll be there. 'cause that's what friends are supposed to do. Oh yeah. Ooh, ooh. You can count on me 'cause I can count on you.